I'm Joseph Breen, a neurotologist at the Mayo Clinic in Jacksonville, Florida. As a neurotologist, I'm a surgeon who specializes in the treatment of tumors that involve the ear and skull base. The skull base is the portion of your body where nerves and blood vessels travel to connect your brain to the rest of your head and neck. Vestibular schwannomas, or acoustic neuromas, are rare, but they're one of the most frequently treated skull base tumors here at the Mayo Clinic in Florida. If you've been recently diagnosed with a vestibular schwannoma, you may know that hearing loss in one ear and dizziness are the most frequently experienced symptoms for patients with these tumors. They're typically diagnosed by performing an MRI scan of the brain. Vestibular schwannomas are benign growths that develop from the cells that insulate the vestibular nerves. These nerves carry information about balance and head movements from your inner ear to your brain. The vestibular nerves are in contact with the cochlear nerve and the facial nerve, which transmit signals for hearing and facial expression to and from your brain. While vestibular schwannomas are benign and are not cancers, they can affect the function of these nerves. Many vestibular schwannomas are diagnosed when symptoms are mild and the tumors are small. In many such cases, no treatment may be required at all. While we're always learning more about how these tumors behave, we now know that some of these tumors grow very slowly or stop growing entirely, at least temporarily. Here at the Mayo Clinic, we would help you weigh the pros and cons of actively treating versus simply watching your tumor in this situation. We take into account many factors, including your hearing, general health, age, and personal preferences. If vestibular schwannomas become very large or are growing rapidly, they can cause additional symptoms like facial numbness, vision changes, headaches, or even swallowing and speech difficulties. These situations would almost always lead to a recommendation for surgery. Still, other patients may be treated by a form of focused radiation therapy that can stop their tumor from growing any further without requiring any surgery. When patients with skull-base tumors travel to see us at the Mayo Clinic, they'll see specialists who work together to create a unique treatment plan. Our goal is to provide care that maximizes safety, function, and quality of life for each patient. Skull-base surgeries can be long and complex, and a very large team of doctors, nurses, and technicians are all focused on the best outcome for a single patient. We have a team of highly trained, experienced, and internationally renowned specialists that are passionate about providing the highest quality of care for people with vestibular schwannomas. You can connect with us at mayoclinic.org, where you can find more information about this tumor, treatment options, virtual consultations with our team, and visiting us at Mayo Clinic in Florida.